Okay, so let's start. Do you remember what we have discussed in the last class? I have started with the tongue, if you remember. Okay, I have completed the applied anatomy of the tongue, and then I have started with the palate. Okay, so what we have discussed in the palate so far? These things are important. You can expect questions from these topics during the time of exam. Now, if you remember, last class we have discussed about the palate. So, palate is nothing but the roof. Okay, palate is the roof of the oral cavity that we have discussed that day. Next, in the palate, we have seen that it is divided into two parts. What are they? Hard palate and soft palate. So, what you have studied in hard palate? First of all, we have seen the structure of the hard palate. Okay, in the structure of the hard palate, we have seen bones. So, which are the bones forming the hard palate? Yes. So, see, if you will not revise, then I can't help you. All those things we have discussed, I have shown you the diagrams also, if you remember. Okay. Then we have discussed okay. So first of all, we have seen the structure of the hard palate. Okay. Then the bones forming the hard palate. Then the masticatory mucosa. Okay. That means if you see the roof of the oral cavity, this oral cavity, if you see the roof of the oral cavity, the hard palate is covered by a mucous membrane. Okay. That is called as masticatory mucosa. Now in masticatory mucosa, some sharp-edged fibers are there which hold the mucosa with the periosteum of the hard palate. Or else whenever we are eating something, whenever we will chew and when the bolus is going towards the oropharyngeal isthmus, the mucous membrane can displace from its position. That's why those sharp-edged fibers are there. Next, from the masticatory mucosa, what are the different features? Okay, so masticatory mucosa is covering the roof of the oral cavity, and two important features we have discussed that day in masticatory mucosa. What are those two features? Okay, so these are some important features which we have discussed in the masticatory mucosa. Okay. Next, in the hard palate, let me show you the diagram of the hard palate. Okay, if you see the so this is the hard palate. Okay. Now in the hard palate, here you can see the bones which are forming the hard palate. Okay. So, and you can see the sutures also. So, first of all, we are getting the intermaxillary suture and palatomaxillary suture. Okay. Posterior, this is the anterior aspect, this is the posterior aspect. So, posterior aspect is made up of horizontal plate of palatine bone, and anterior aspect is made up of palatine process of maxilla. Okay. That we have discussed that day. Next, in the hard palate, as you can see, there are some important foramina present. Okay, Now why those foramina are present? Because the structures which are coming through this foramina, they will come and they will supply the oral cavity. That's why those foramina are there. And that I have told you that those foramina I will be studying in osteology. That's why I am not taking it right now. Okay. Next, here you can see the masticatory mucosa, hard palate. Okay. Now this masticatory mucosa which is covering the hard palate, first of all, some sharpish fibers are there which will hold the masticatory mucosa. Next, in the features, what we are getting, median or also called as lingual raphe, and along with that you can see palatine rugae are there, or also called as transverse palatine ridges. Okay, so that we have discussed, especially in case of the hard palate. Next, can anyone tell me what will be the functions of hard palate? No. What are the functions of hard palate? Just imagine whenever you are eating something at that time, what function is done by the hard palate? Suppose you are drinking some liquid with the help of a straw. Whenever you are sucking, at that time the pressure which is required in the oral cavity, that is produced by the hard palate. Okay. Next, it is separating the oral cavity, nasal cavity. Then hard palate is giving attachment to the soft palate. Okay, so these are some important functions of the hard palate. Okay, so in the functions, as you can see, during suckling the hard palate used to create a vacuum that forces the liquid so that it can be ingested easily. Okay. Next, it gives attachment to the tongue. Hard palate gives attachment to the soft palate. Along with that, it also helps in producing certain phonetic sounds. Okay. And I have told you, if there is any defect in the hard palate, that means if there is any cleft in the hard palate, okay, if the fusion is not taking place of the palatal processes, then what will happen? The person can speak, but whatever he or she is speaking cannot be understood. Okay, so that's why hard palate is important. Next, in the soft palate, do you remember what we have discussed? See, you have to revise whatever we are discussing in the classroom. What is the shape of the soft palate? It is quadrilateral shaped. Whenever it is not doing any function, it is quadrilateral shaped, soft palate. Okay, so in the soft palate, it is just a revision what we have discussed last week. In case of soft palate, first of all we have seen the parts of the soft palate where two surfaces, two borders, okay, two surfaces, two borders are there. Then in the soft palate we have seen that it is quadrilateral in shape when it is not doing any function, right? Next, in case of hard palate, we have seen the structure. Okay, so the soft palate is having two different surfaces. Okay, for that the lining epithelium in those two surfaces are different. Okay, for example, the soft palate, if you see the borders and the surfaces. Okay, so two surfaces are the anterior surface and posterior surface. So the posterior surface is continuous with the floor of the nasal cavity. That's why in that particular area, what will be the lining epithelium? It is respiratory epithelium. And what about the oral surface? It is lined by stratified squamous non-keratinized epithelium. Okay, so two different types of lining epithelium are there, which you can see in the soft palate. Okay, next, in the soft palate, if you see all the layers from the pharyngeal surface to the oral surface, okay, so many layers are there. Can you tell me how many layers are there from above downwards? 7 layers are there. Okay, I have shown you the diagram also, if you remember. See, I was talking about this diagram. In the soft palate, okay, so this particular mucosal lining, this is for pharyngeal surface, okay, and this is for oral surface. So which lining epithelium is present over here? Respiratory epithelium. Okay, from here you can expect a short question. Okay, so respiratory epithelium is present over here, and this side it is oral epithelium of stratified squamous non-keratinized epithelium. Next, in between them you can see different layers are there. After that, a layer of palatine glands are present. As you can see, palatine glands are present over here. Okay, then this particular layer is made up of skeletal muscle. Most of the muscles are present over here except two muscles. What are they? These are the musculus uvuli and palatoglossus. These two muscles are not present here, except that all the muscles are present. Okay. Next, deep to that, here what we are getting? Here we are getting the musculus uvuli and palatoglossus. After that, again a layers of palatine gland. Okay, and then we are getting the mucous membrane of the oral epithelium, or that is stratified squamous non-keratinized epithelium. These are the different layers of soft palate. Okay. Now, can anyone tell me what is the attachment of the soft palate? Where it is attached? Soft palate कहाँ पे attached रहता है? And the soft palate, if you see, what are the three parts of the soft palate? First of all, it is fibrous, then muscular, and glandular. Three parts are there. Anterior part is fibrous in nature. Okay. Middle part is muscular in nature, and posterior part is glandular in nature. Okay, all those things we have discussed that day about the soft palate. I know you will not be revising this topic. That's why in the beginning I am revising and giving a quick revision of this topic, so that whatever we have discussed you can recall. So here you can see anterior third is fibrous, middle third is muscular, and posterior third is glandular in nature. Okay. And if you see the soft palate, it is fibro-musculo-glandular carotene, okay, which is hanging from which part? From the posterior aspect, or you can say posterior margin of the hard palate. Okay. Now, when it is hanging, in which direction it is going? As you can see, it is extending backwards and downwards in between the nasal and the oral parts of the pharynx. Okay. So that is the extension of the soft palate. Okay. Now, in the soft palate, as you know, no bony attachment is there, bones are not present. Then how it is getting the strength? The soft palate by the palatine aponeurosis. Okay. Now, how the palatine aponeurosis is formed? These are the points from where questions can be expected. You can expect some question that no bones or no bony attachment is there in the soft palate. Then how it is getting its strength? With the help of palatine aponeurosis. Now the question is, how the palatine aponeurosis is derived from where? From which muscle, or the tendon of which muscle? Okay. So all those points were discussed that day. You see, this is the soft palate which is hanging from the posterior margin of the hard palate. Okay, here you can see the palatine aponeurosis. Okay, so aponeurosis is the expanded tendon of the insertion of tensor villi palatini. So the tendon of the tensor villi palatini muscle, okay, when it extends laterally, it is forming the aponeurosis. Okay, anteriorly it is attached to the posterior margin of the hard palate. Okay, as you can see, attached to the posterior margin and under surface of the hard palate up to the palatine crest, and on both the side it is continuous with the tendon. Now in the midline or in the middle, it gets splitted to enclose a muscle that is called musculus uvuli. Palatine aponeurosis is very important because it is giving strength to the soft palate. Along with that, it is also providing attachment to the various muscles. Okay. Next, in the soft palate, as you know, tonsils are also there. That means aggregation of lymphoid tissues are present, and along with that, some taste buds are also present. Okay, and those taste buds are very active during the time of children. Okay, in children, those taste buds are very active. So taste buds are also there, and along with that, aggregation of lymphoid tissues are also present. Okay, in the soft palate. Now, the question is, in which surface the taste buds are present? Now when the soft palate, as you can see, now see, this is the soft palate, okay. Now this particular part is also called as pharyngeal surface, and this is the oral surface, okay. So in this particular oral surface you will be getting the taste buds, okay. So some taste buds are present in the soft palate also, okay. Next, in the soft palate, in the structure after aponeurosis, the most important part is the muscles. So how many muscles are there in the soft palate? How many muscles are there? Total 5 pairs of muscles are there. 5 pairs का मतलब क्या है? Total 10 muscles are there, 5 and 5. Okay. Now among them, which are the intrinsic muscles and which are the extrinsic muscles? Or how many intrinsic and how many extrinsic muscles are there? Only one is intrinsic, remaining all are extrinsic muscles. Okay. तो देखो यहाँ से short question आता है. For example, which is the intrinsic muscles of soft palate? You will be getting 4 options. Okay. So which is the intrinsic muscle? Musculus uvuli. Musculus uvuli is the intrinsic muscle of the soft palate. Only musculus uvuli. Remaining all are extrinsic muscles. Okay. So I hope you know the difference between the intrinsic muscles and extrinsic muscles. Yes. Okay. So up to that much we have discussed that day, if you remember. Okay. So again we are going to do a quick revision of the muscles attached to the soft palate, and then I'll go to the next part. Okay. So as I said, total 5 pairs of muscles are there, right? Now in the 5 pairs of muscles, as you can see, these are the muscles. So first you should know the list of the muscle. As you can see in the diagram, levator, veli, palatini, tensor, veli, palatini. Then we are getting the palatopharyngeus, palatoglossus and musculus uvuli. And musculus uvuli is the only intrinsic muscle of the soft palate. Remaining jitna bhi muscle hai, all are extrinsic muscles. Okay. Now you have to understand the origin and the insertion. Why? Because there are some very important functions of those muscles. Because till now we have not discussed the functions of soft palate. Okay. Now why I am giving more focus on the functions of soft palate? Because every time whenever you are swallowing something, just now you had your lunch. So during taking lunch, when you swallowed, at that time your soft palate has helped a lot. Without having soft palate you can't swallow properly. Okay. So that's why you should know the functions of the soft palate. Okay. So whenever you are swallowing anything after eating, it seems that it's very easy, but it's not that easy. So many processes are going on. Okay. So one by one we have to understand, and entire process is called as deglutition. Okay. So in case of the soft palate, okay, what are the muscles? The first muscle is the tensor veli palatini. As you can see, the tensor veli palatini. Here you can see the tensor veli palatini. So what is the origin of the tensor veli palatini? So as a whole, we'll say that it arises from the sphenoid bone right now, because there are various parts of the sphenoid bone which you have not studied. That's why as a whole we'll say that it is arising from the sphenoid bone. Along with that, it is also taking part from the pharyngotympanic tube or the auditory tube. As you can see, this is the auditory tube. Okay. So mostly it is the tensor veli palatini, mostly it is arising from the sphenoid bone, various parts of the sphenoid bone, and along with that it is also arising from the auditory tube. Okay. Now where it is getting inserted, as you can see, it is getting inserted in the palatine aponeurosis. That's why palatine aponeurosis is important, because it is giving attachment to the sum of the muscles of soft palate. Okay. Next is the levator veli palatini. See, this is the levator veli palatini. Okay. The levator veli palatini, it also arises from the cartilaginous part of the pharyngotympanic tube and the petrous part of the temporal bone. As you can see, this is the levator veli palatini. Okay. Now it also getting attached to the palatine aponeurosis. Okay. So these are the two muscles which are coming from above, and then they are attaching into the soft palate. Okay, aponeurosis of the soft palate. Next, two muscles are there. Okay, which are, you can say, arising from the aponeurosis of the soft palate, and then they are going downwards, as you can see in the diagram. So which muscle is this? This is palatoglossus and this is palatopharyngeus. Okay, so what is the origin of the palatoglossus? Palatoglossus, if you see, origin will be the palatine aponeurosis, as you can see. And what about the insertion to the side of the tongue? Okay, that also on the posterior aspect. Next, palatopharyngeus. As you can see, this is the palatopharyngeus. So two slits are there by which the origin of the muscle is taking place, the palatopharyngeus. Okay. Now, if you see the palatopharyngeus, it is arising from the hard palate as well as posterior aspect of the hard palate as well as from the palatine aponeurosis. Now, okay. Next, see, it is going downwards laterally. Now, where it will go and attach? It will go and attach to the lateral wall of the pharynx. It is going and attaching to the lateral wall of the pharynx. Pharynx we have not studied. We will discuss about the pharynx this week only. Okay. So these are the extrinsic muscles. Next, only one intrinsic muscle is there, that is called musculus uvuli. Okay. As you can see, this is the musculus uvuli. This one. Okay. Now, musculus uvuli, what is the origin? So the origin will be the posterior nasal spine and the palatine aponeurosis. Okay, and mucosa of the uvula, that is the insertion of the musculus uvuli. Okay, as you can see in the diagram, this is the musculus uvuli. So these are the muscles of the soft palate. Okay, now there is a very famous line which is related to the head and neck portion. That means all the muscles of this particular part is supplied by this nerve except this muscle which is supplied by this nerve. Repeatedly I was mentioning. So same thing is applicable for soft palate also. So all the muscles are supplied by what? Any idea? All the muscles of the soft palate will be supplied by what? All the muscles of the soft palate are supplied by pharyngeal plexus derived from vagus nerve. Okay, pharyngeal branch of vagus nerve via pharyngeal plexus or pharyngeal plexus, which is formed by the branches of the vagus nerve. Except one, except tensor villi palati. Tensor villi palati is supplied by nerve to medial pterygoid. Okay, which is a branch of mandibular division of trigeminal nerve. That is the difference. Okay. So as you can see, all the muscles are supplied by pharyngeal branch of vagus via pharyngeal plexus, except the tensor villi palatini, which is supplied by nerve to medial pterygoid, which is a branch of mandibular division of trigeminal nerve. Okay. Next, if you see the function, okay, the functions are very important. Okay. So first of all, if you see the tensor villi palatini, so what it will do? It will tense the soft palate, and along with that, it opens the pharyngotympanic tube or the auditory tube. Okay, during the time of swallowing and yawing. Next, if you see the levator villi palatini, so it is also coming from above. So what it will do? It will elevate the palate, soft palate. As you can see, it elevates the soft palate during swallowing and yawing. Okay. Next, palatoglossus. So palatoglossus directly it will be acting on the tongue. Okay, though it is going to the tongue from above. So what it will do? It will pull the tongue. It will elevate the tongue. It helps in elevation of the tongue. Okay. So palatoglossus, as you can see, elevates the posterior part of the tongue and draws the soft palate onto the tongue. That is the main function of the palatoglossus. Okay. Next, the palatopharyngeus. So it also helps in creating tension to the soft palate. Okay. Along with that, it pulls the wall of the pharynx superiorly, anteriorly, and medially during the time of swallowing. Okay. So this also helps during the act of deglutition. This palatopharyngeus. Okay. And lastly, the musculus uvuli. So it shortens the uvula and pulls the uvula superiorly. Okay. Now, the day I had discussed about the uvula also. Okay, tongue-like structure which is hanging from the inferior aspect of the soft palate. Okay, and if you see, it is mainly made up of muscle, that is the musculus uvuli, and it is covered by a mucous membrane, the uvula. And from the uvula, two folds are extending downwards and laterally, anterior fold and posterior fold. Okay. Now that I have discussed, in anterior fold is also called as palatoglossus fold, posterior fold is called as palatopharyngeus fold. Okay. Now here, as you can see, all the muscles are extrinsic except the musculus uvuli, which is intrinsic in nature. Okay. So with the help of this, we have discussed about all the muscles of the soft palate, the origin, insertion, nerve supply, and action of the muscles in the soft palate. Okay. Next. As I said, soft palate is very important structure. Why it is important? Because it is helping during the time of deglutition. Okay, whenever we are swallowing, it is helping. That's why what happens, the muscles which are attaching with it, not all the muscles, some muscles, they are forming U-shaped slings, and which you can see in the diagrams. So U-shaped slings are formed by few muscles which are attached to the soft palate. Okay, and they are having very important functions. So first of all, you can see a sling of levator veli palatini. So here you can see the sling of levator veli palatini. Whenever it is attaching to the palatine aponeurosis, at that time also it is forming U-shaped sling. Okay. Next, which elevates the palate, then that of the passavans ridge during the palatopharyngeus. Okay. So here you can see the sling of the palatopharyngeus muscle, okay, which is forming the passavans ridge. Now this is very important, okay, a very important structure which also helps during the time of deglutition, the passavans ridge, okay, and this passavans ridge, how it is formed, that we will discuss, okay. So here you can see one sling is present which is formed by the sling of levator veli palatini, which helps in elevating the soft palate. Next, another sling is formed U-shaped, which is formed by the fibers of the palatopharyngeus, and this is forming the passavans ridge. This also helps during the time of deglutition or swallowing. And then another U-shaped sling is formed, and that is formed by the palatoglossus, okay, around the oropharyngeal isthmus. Oropharyngeal what is the meaning of oropharyngeal isthmus? Actually, it is a passage between the oral cavity and the oropharynx. Okay, pharynx is having three parts. Okay, that is nasopharynx, oropharynx, and laryngopharynx. So the oral cavity and oropharynx, in between them a small passage is there. It is called oropharyngeal isthmus. Okay, so during the time of deglutition, this is also helping this particular sling. Okay, that's why these three group of muscles, they are forming U-shaped sling. Okay, when they are attaching to the aponeurosis of the soft palate. Okay, and if anyone asks you what is their important function, so their important function is they help during swallowing. Okay, now every time I am mentioning they are helping during swallowing, but how, I have not explained. Okay, so that will be discussed during the stages of deglutition. 3 stages are there. At that time, each and every point will be discussed. Now I am not mixing it. Okay, because now we are in soft palate, and the deglutition part is mainly related to the pharynx. Once I discuss the structure of the pharynx, layers of the pharynx, at that time during the function we will discuss the deglutition part. Okay, so that is all about the structure of the soft palate. Next will be the blood supply, nerve supply. Okay, so in the blood supply, mainly the branches of the external carotid artery is supplying the soft palate, but exactly which branches? So lesser palatine, ascending palatine, and palatine branches of the ascending pharyngeal artery. Okay, so lesser palatine is a branch of maxillary artery, ascending palatine is a branch of facial artery, and palatine branches coming out from the ascending pharyngeal artery. This supplies the soft palate. Okay, these are the branches which supplies the soft palate. Next, in venous drainage, so where the blood will be drained. In case of venous drainage, it is drained into the pharyngeal venous plexus and the pterygoid venous plexus. From pterygoid venous plexus, maxillary vein is formed, and from the pharyngeal venous plexus, it will drain into the internal jugular vein. Okay, and if you see the lymphatics, retropharyngeal and deep cervical lymph nodes, these are the lymph nodes which are draining the lymph from the soft palate. Okay. This nerve supply, blood supply is blood supply, lymphatic drainage is very simple, but the nerve supply is not that simple. Okay, do you remember the nerve supply of tongue? What are the points I have mentioned while discussing about the nerve supply of tongue? First, I have mentioned that in nerve supply of the tongue, we have to know about the motor supply. That means muscles of the tongue, which nerve is supplying the muscles of the tongue. Then secretomotor fibers, okay, because those lingual glands, which anterior lingual glands are present, okay. So for secretion, we should know from where the secretomotor fibers are coming, and after that, sensory fibers. So how many types of sensations are there in the tongue? Two types of sensations are there: general sensation and spatial sensation. That is the taste sensation. Same thing will be followed over here. Okay. Same thing will be followed over here. So in case of the nerve supply of soft palate, there are some points which you have to follow. Okay. So first of all, the motor supply. The motor supply में क्या होगा? That means which nerves are supplying the muscles of the tongue. Okay. So which nerve is supplying which muscle? All the muscles of the soft palate are supplied by pharyngeal plexus, which comes from vagus nerve. Okay, except tensor veli palatini, which is supplied by nerve to medial pterygoid, that is the branch of mandibular division of trigeminal nerve. Okay, so from the beginning I am mentioning that every time whenever we are discussing those points, especially about the nerve supply, an exception is there. Okay, and you have to know it. Okay, I think next week you are having one exam, 22nd or 23rd, 24th, like this. Okay. At that time, entire head and neck will be there. Don't ask for any suggestion. Topics will be entire head and neck. Okay. So please be careful. From there, this sort of questions will be asked. Next, so first, as you can see, motor supply, then secretomotor fibers. Secretomotor fibers will supply what? Secretomotor fibers will supply what? Any idea? In the layers of the soft palate, okay, I have shown you that palatine glands are there. Layers of the soft palate. Can you see the diagram? Now this diagram is showing the layers of the soft palate. Okay. Now in the layers of the soft palate, can you see the palatine glands? Okay, now these palatine glands, from where they will get the nerve supply? From the secretomotor fibers. Okay, now in secretomotor fibers, you know that two parts are there. What are those two parts of the secretomotor fibers? Preganglionic part and postganglionic part. Not a single student is responding. How pathetic this is. In submandibular region, if you remember, we have discussed about the submandibular ganglion, the connections of the submandibular ganglion. Okay, at that time I have discussed about those secretomotor fibers. What are preganglionic fibers, what are postganglionic fibers, from where they are coming. Same thing is applicable over here. So ये जो glands है, these glands, from where they will get the nerve supply. Have you heard about superior salivatory nucleus? कहाँ पे रहता है? Superior salivatory nucleus. So secretomotor fibers, as I said, it is divided into two parts: preganglionic and postganglionic. Preganglionic fibers, from where they will come? They will come from superior salivatory nucleus. Okay, as you can see, the preganglionic fibers, they are arising from superior salivatory nucleus. Okay, after that they will pass through the facial and greater petrosal nerve to pterygoid canal. Okay, these are the branches of facial nerve only, and then they will rely into the pterygopalatine ganglion. not submandibular ganglion, pterygopalatine ganglion. Have you studied about the pterygopalatine fossa? Have you studied about pterygopalatine fossa? In pterygopalatine fossa, one of the major content is the pterygopalatine ganglion. Pterygopalatine ganglion is the largest parasympathetic ganglion. One of the largest parasympathetic ganglion. Okay, so the preganglionic fibers which are coming from a superior salivatory nucleus, they will pass through the branches of facial nerve, various branches of facial nerve. Ultimately, they will reach which part? They will reach the pterygopalatine ganglion to rely over there. After that, from the ganglion, the fibers which are coming out, those are called as postganglionic fibers, and they are completely secretomotor fibers. Okay, as you can see over here, postganglionic fibers reach the gland via greater and lesser palatine nerves. Okay, so that's why this pterygopalatine ganglion is important. And I know along with the pterygopalatine fossa, you have studied about the pterygopalatine ganglion. Okay, don't ignore this one, pterygopalatine ganglion, very important. Okay, so like this, these are the fibers which are responsible for secretion of the palatine glands. Next, sensory fibers. So how many types of sensations are there from the soft palate? Again, two types of sensation, general sensation and taste sensation. Because in the beginning I have mentioned that in soft palate also some taste buds are present. Okay, so for general sensation, greater and lesser palatine, long sphenopalatine and glossopharyngeal nerves are responsible. Okay, now this greater and lesser palatine, long sphenopalatine, these are the branches of maxillary division of trigeminal nerve. Okay, and the glossopharyngeal nerve. This is for general sensation. Okay. Next, for the taste sensation, as you can see from the soft palate, it is by glossopharyngeal nerve and lesser palatine nerve. Okay, so like this, for nerve supply, you have to segregate. Don't write everything together. First, you have to give the point motor supply, then secretomotor. In secretomotor, two parts are there: preganglionic part, postganglionic part, and lastly the sensory. In sensory also two parts are there: special, normal sense or general sensation, and special sensation. Okay, that is for soft palate. So nerve supply of those structures are not that simple. Okay, so there is a flow chart. Okay, you can see the flow chart, and this flow chart is for secretomotor fibers. Okay, so with the help of this flow chart, you can understand the secretomotor fibers. कहाँ से आता है? From where they are coming? They are coming from superior salivatory nucleus. Okay, कहाँ पे रहता है superior salivatory nucleus? Pons. Pons में रहता है. Okay, that is brainstem. When we will study the cut section of the brainstem, at that time you will come to know. ক্লাসের মধ্যে না, not allowed during the time of class. After class, go and sit down. Don't ask like this. Now secretomotor fibers, as I said, from where they are coming? They are coming from superior salivatory nucleus. Okay, so this is the flow chart. So I'll request everyone, please study those secretomotor fibers with the help of flow chart. That will help you to remember or understand the secretomotor fibers from where they are coming. Okay. Now always remember, you have to mention which part is the preganglionic and which part is the postganglionic part. So here you can see the pterygopalatine ganglion up to this much. This is the preganglionic part. Okay. This is the postganglionic part. Okay. Next, in this diagram, you can see the blood supply. Okay, you can see the blood supply. This is the blood supply for hard palate, and you can see this is the blood supply for soft palate. And along with that, you can see the nerves also. Okay, which are supplying the various part of the soft palate. Okay, so this diagram will help you to understand the blood supply. Here also, this diagram is also important. So two views are there. This is the lateral view. Okay, so ये देखो, this is the hard palate, and this particular part is the soft palate. ये देखो, here you can see the palatine aponeurosis. So these are the nerves and blood vessels which are supplying the soft palate. Okay, and this is the inferior view. Okay, inferior view means you are looking at the soft palate, okay, from below. Okay, this is how you can see the soft palate and the blood supply, nerve supply of the soft palate. Okay. Now the most important part, so we have discussed all the structures, nerve supply, blood supply. Now the most important part, that is the functions of the soft palate. Okay, so there are some very important functions. As I said, every day we are using our soft palate. Okay, so first of all, it isolates the mouth from the oropharynx during chewing, so that the breathing is not affected during the time of chewing. I hope you have observed that whenever you are chewing anything, you can breathe. Have you observed? Anything you are giving into your mouth, oral cavity, you are chewing food, at that time you can breathe. जब हम लोग खाना खाते हैं, जब हम लोग चबाते हैं, that time we can breathe. That is only because of the soft palate. Okay, that is the important function. Now, how it is functioning? So what it will do, it will isolate the oral cavity from the oropharynx. Okay, तो oral cavity के ठीक पीछे रहता है oropharynx. So oropharynx and oral cavity are separated, so that whatever we are chewing, it will not go to the oropharynx that time. Okay, that is one function. Next function, as you can see, it separates the oropharynx from the nasopharynx. Okay, so pharynx we have not discussed till now, but please try to understand that three parts of pharynx are there. Okay, first is the nasopharynx, oropharynx and laryngopharynx. Okay, now what it will do, the soft palate, it will separate the oropharynx from the nasopharynx. How it will separate? By locking the pachyderms ridge. Okay, so I have shown you the palatopharyngeus muscle fibers which are forming the pachyderms ridge. Okay, so by locking the pachyderms ridge during the second stage of the swallowing. Now why it is required? So that the food doesn't enter the nose. So whenever you are swallowing, at that time a very important function is done. First of all, the soft palate will get elevated and it will get approximated with the pachyderms ridge. Okay, now when it is getting approximated with the pachyderms ridge, okay, which is present in the nasopharynx, so the food will go downwards. Okay, it won't go back into the nasal cavity, only because of this function, this locking of the pachyderms ridge. So that is also important functions of the soft palate. Next, by bearing the closure of the pharyngeal isthmus, okay, the quality of the voice, whatever we are speaking, some consonants are changed, so that the quality of the voice improves. Okay, yes, you please get out of my classroom. Yes, you, Thakuria, yes, please get out and you will be marked absent. Please leave fast. So this is one important function. Okay, so by bearing the closure of the pharyngeal isthmus, okay, what it does, it changes the quality of the voice which are produced. Okay, and that helps in modifying some consonant whenever we are speaking. Okay, so that is a very important function. Next, during sneezing, I hope you have observed that whenever you are sneezing, at that time what happens? How the blast of air is coming out? Whenever you are sneezing, sneezing के time में क्या होता है? You know that a blast of air is coming out. Okay, so this blast of air is divided into oral cavity and nasal cavity and oral cavity with the help of this soft palate. Okay, so that if the entire blast of air is directed towards the nasal cavity, then the delicate structure of the nasal cavity may get damaged. Okay, that's why it is dividing the blast of air into through the both cavities. Okay, another important function is there of the soft palate is during the time of coughing, it directs the air and sputum into the mouth, not into the nose. Okay, suppose whenever you are coughing, after that, how do you spit? You spit through your oral cavity. Okay, so whenever you are spitting, the sputum, how it will come into the oral cavity? That is directed by the soft palate into the oral cavity, so that you can spit it out. Okay, So these are some important functions of the soft palate. So not only in swallowing, there are some other important functions of soft palate also. Okay, so functions are written here very clearly in easy language. I'll request everyone, whenever, I know you are very busy these days, whenever you are getting free time, please go through these points, you will understand, because these functions are taking place in your body every day. Okay, every day you are performing these functions, almost every day. Okay, now here I have mentioned about the passivance ridge. So let me show you in detail about the passivance ridge. Can you see the location of the passivance ridge? Here, this is the location of the passivance ridge. Okay, so what exactly is this passivance ridge? So some fibers of the palatopharyngeus, what they will do, they will pass circularly deep to the mucous membrane. Okay, and they will form just like a constrictor. Okay, they will form like a sphincter, and which is situated deep to the superior constrictor muscle of the pharynx. Okay, next, whenever the fibers will contract, at that time a ridge like structure will be formed and it will get raised, and that is called as passivance ridge, as you can see in the diagram. Okay, so what happens when the soft palate is elevated, it comes in contact with the ridge. Okay, both of them will close the pharyngeal isthmus between the nasopharynx and the oropharynx. Okay, now here you can see this is the passivance ridge, which is formed by the fibers of palatopharyngeus. Okay, now when the soft palate elevates, so this will elevate and then it will come close together and it will block the oropharyngeal isthmus. Okay, as a result, what will happen? Whatever we are swallowing, it will come like this downward. It can't go back into the oral cavity. So that is the important functions of this passivance ridge. Okay. So that is all about the structure of soft palate. Next are some important applied anatomy which are related to the soft palate. Okay. First is the gag reflex. Anyone, have you heard about this gag reflex? Yes. So you know about the gag reflex. So any unfamiliar object, if it is touching the soft palate, okay, or it is touching the mucous membrane of the oropharynx, then a reflex is there. Okay, as a result, patient will start coughing, okay, retching and gagging. Those are the symptoms which are taking place, okay, when this gag reflex is there. Now, one thing which you don't know, in case of gag reflex, one afferent limb is there and one efferent limb is there. Okay, so as you can see, the afferent limb of any reflex in our body is having an afferent limb and efferent limb. Okay, so whenever that particular part is touched, okay, so the sensation which is going, that is the afferent limb. So that afferent limb is formed by which nerve? As you can see, it is provided by the glossopharyngeal nerve. And efferent limb, the motor supply which is coming, from where it will come? It will come through the vagus nerve. Okay, that is the gag reflex. Next, have you heard about Helmich maneuver? Anyone? Have you heard about Helmich maneuver? Nahi suna? Wait, let me show you the diagram. Have you seen this procedure? So that is only called Helmich maneuver. Okay, so suppose if choking of food or fluid has taken place in, and it has obstructed the laryngeal part, okay, it causes laryngeal obstruction. During that time, person will unable to breathe. If the patient is unable to breathe at that time, what will happen? There will be less amount of oxygen going into the blood. That will lead to unconsciousness, coma, etc. Okay, so at that time, what happens? Helmich maneuver is given. Now, how the Helmich maneuver is given? As you can see, first of all, you have to stand behind the patient. Okay, then you have to ask the patient to lean gently forward. Then one hand you will make a fist and another hand will be put in above this particular fist. Okay, and where you will put the fist? In the epigastrium, epigastric region. I hope you know where is the epigastrium. Okay, and then what you will do, you will give 3 to 4 abdominal thrust directed upward and backward, like this abdominal thrust upward and backward. So as a result, what will happen? The remaining air which is there in the lung will give a pressure towards the larynx, and if any obstruction is there, it may be dislodged. Okay, so it is a life-saving procedure which is done in order to save the life of a person. That is the Helmich maneuver. Okay. Now this whatever you have seen, this Helmich maneuver is given for adult. For children, it is not same. It is different. Now here you can see how the Helmich maneuver is given for children. Okay. So at least 5 blows to the back of the child with the help of the palm. Okay, on the back of the infant or back of the children. Okay. At that time, the children may be in sitting, lying down position. Okay, and then if the obstruction is still not going, then you can give the Helmich maneuver. But what you will be doing, procedure will be same. Okay, you will be keeping the patient in a chair or in a table, and then just below the sternum, you will put both the hands and you will give the abdominal thrust. Okay, at least 5 times it is given, and then you have to check whether any dislodged particle has came into the oral cavity or not. Okay, so this is how the Helmich maneuver is given. It is a life-saving technique. Next, cleft palate is there. Okay, so it is a congenital anomaly, cleft palate. Okay, and it is how it occurs, non-fusion of right and left palatal process. Right and left palatal process, if it is not fusing properly, then we are getting the cleft palate. Different degrees of cleft palate are there. Okay. Now when the cleft palate is taking place, it may be bilateral, it may be unilateral. Let me show the diagram. Here you can see this is the bilateral cleft palate, this is unilateral cleft palate. Okay. This is the partial cleft palate, then this is the cleft soft palate, and this is bifid uvula. Okay, so these are some congenital anomalies of the cleft palate. Okay. Lastly, you can see the paralysis of the soft palate. Okay, if the paralysis of the soft palate takes place, then what will happen? First of all, there will be nasal regurgitation of the liquid. Okay, so liquid whatever you are swallowing, it may go to the nasal cavity when the soft palate is paralyzed. Okay, then nasal twang will be there in the voice, flattening of the palatal arch, and the most important part, uvula will be deviated to the opposite side. Okay, as you can see in the diagram, this is the uvula, and you can see it is deviated to the right side. So if it is deviated to the right side, that means the left vagus nerve is paralyzed. So with the help of this, we can judge the integrity of the vagus nerve. Okay, so that is all about the soft palate. Okay, so most of the things of the soft palate we have discussed. So I'll request everyone please to study about the soft palate, because that particular part is very important. Okay, thank you.